I'm Dr. Kenny Levine. Welcome back to Health Talk. I'm here with Dr. Richard Greene. Dick, we started talking a little bit about the cosmetic things you do. Is there any limit to the amount of hair transplanting somebody can have done?
Well, you have to have good donors. So I always point at the back and sides and say, that's your savings bank. Some people have $1 million, they have a lot of donor area, and some people have very little. If they have very little donor, I'm hesitant to do them unless they're just looking for something simple, like to put a new front line in, etc. And I can tell them, because they just won't have sufficient donor for later procedures. So everybody is different. You really, through the years, you get much better picking your patients. Your hair coloration is wonderful. You'd be a 10 out of 10 candidate.
Right.
The color is important because it matches with the scalp color.
Sure, this silver color matches
silver
with my
is
silver
wonderful.
Scalp.
It's
It's
wonderful.
Great. Right, okay. And once you remove the hair follicle from the back, it's gone forever?
Yes,
So you
but
take it from a place
it's
you don't
done in
need.
a very cosmetic manner. We take it out in a strip, it's then sewn. There's a little fine line. Sometimes people will say to their barber, I had a hair transplant, and the barber said, well, where did he get it? You know, it's not like the old days where people just punched a lot of holes in the back and left them to heal in.
Gotcha.
You know?
You talked a little bit about Botox. Let's talk a little bit about fillers.
Very popular today.
How's
And there are
that?
many. You know, in the old days, people did collagen. But the problem with collagen is you look 6 weeks later, 8 weeks later, and you needed it again. Now they have a lot of hyaluronic fillers. The popular ones are Restylane, Perlane, Juvederm, all from different companies. Again, it's fitting the patient and their presentation to the proper product. And some people will overdo it, and people don't want to be overdone. They don't want to look funny. You want just enough to look natural, usually 1 or 2 syringes. You can take out the lines in the nasolabial folds, the little lines above the lip. And it's not just women who want that anymore. And it's really good for about a year. And, you know, if people have a little mad money and they're motivated, and a lot of people don't want to go under the knife or do plastics, you know, so they will come in for the more simple procedures.
Do you ever have a patient come in and want to look like they were at 16?
Of course,
Okay.
but my favorite saying is the enemy of good is better. If you can get them to look good, some people just want to keep driving. Let's do more. They're not going to look good. They're going to look funny, not better.
Are there cases that you say, you know what, this is better handled by a plastic surgeon?
Of course, because there's sometimes I'll tell them, I don't want to disappoint you. I don't want to put in a couple of syringes of filler, and you're going to say I don't see any difference because what you really need is a little lift. And I have a great relationship with all the plastic people because we don't try to do that. And those we're glad to send out because many people are in need of more serious procedure.
Before I forget, tell people where they can find you, your phone number, your address, your website. Because that's important.
We're in general, our whole group is Skin and Cancer. I'm Dr. Richard S. Greene with an E on the end. My main office is in Plantation, but I also go to Hallandale. And the easiest thing to do is call our local number, 954-473-6750, and we would direct you to wherever you have to go.
And the patient can come in to see you if, for instance, their needs are not what you specifically do. You have 53 other
I have built a very good practice in terms of bringing in key people because we all do the best things. Some people come to me for their veins in their leg, and I don't do them, but one of my partners is wonderful. And I'll say he does the veins because he's the best at it, and that's who our group uses. So we try to direct the people to the right individual.
You know, it's interesting because in my dental practice, I believe in the team approach to dentistry. You know, I'm a periodontist, I treat gum and bone disease, we do cosmetic procedures, we treat infants of 4 days old for tongue ties. I treat their great-grandparents for cosmetic procedures and dental implant problems, but I work with restorative dentists, and I work with some dental specialists, and the restorative dentists are the ones that build the beautiful teeth. By the way, you know, in my office for the past few years, I've told patients they can come in to see me at no charge. We do complimentary exams, consults, and radiographs, which allows everybody to come in. There's no financial barrier for them to cross, so they can come see me in my office in Tamarack, Fort Lauderdale. And you know what? We've been in our office now. February 17th will be 38 years. So that's quite an accomplishment.
That's
We're very
wonderful.
proud of that.
I'm over 40 years in plantation, and I take the same opinion. Anybody wants to come talk to me about hair transplants or fillers or Botox, it's a no-charge consultation because I'm glad to talk to them. And many times I don't want them paying, and then I'm telling them they're not a good candidate.
Sure.
So I'd rather have them come in like that.
Dick, this is really a fabulous time. I've enjoyed my conversation with you almost as much as I enjoy playing golf with you. We're going to do that again real soon. Again, I'm Dr. Kenneth Levine with Health Talk. I look forward to seeing you soon. Thank you.